So today we've joined you to talk to you about patient and public involvement and give you some advice about how to get it right. And as Carol mentioned, we've got Gill with us today, who'll be giving a unique insight into a patient perspective on this. So just to give you a bit of an overview of what we will talk about, we're going to have a discussion about the different types of public partnership that we have, involvement, engagement and participation, and what are the differences between those areas. We're going to talk about the expectations we have of PPI members and the expectations we have of researchers when they're conducting patient involvement activities. We'll explore the national guidelines on patient involvement. We'll give you some top tips about what you should be considering when planning your PPI activities. And we've got Gill here to give a public partner perspective on being involved. So we will be talking about public partnerships today, and this is an umbrella term that we use for all activities which involve members of the public. And there are three distinct areas in which we involve members of the public in research, and they are engagement, participation and involvement. And as you can see from this triangle, that's a visual representation of the different amounts of people we generally involve in those different areas. So engagement, we involve a lot more people in than our involvement activities. So firstly, we'll look at participation in research. So you'll all probably be very familiar with this. Participation is where people take part in a research study. For instance, a clinical trial, doing an interview, a questionnaire about your research. And a participant is an individual who's studied in your trial, often, but not necessarily a patient. 870,000 people last year alone took part in research. And the key definition of participating in research is that the public partner is contributing to the findings of research, not to the development of the research. And you need informed consent and ethical approval to have a participant in your research. Engagement is much more about how we tell people about your research and let them know what you found out through your research. So that can be through dissemination events. So some of you might have been involved in our Ask the Researcher events. You can use social media. You can tell people about things through Facebook and through Twitter. You can use newsletters. It could be use the Biomedical Research Centre newsletter, which is now digital. Or you find a newsletter that's relevant to people who are experiencing the condition that you're researching. And there are websites and blogs that you can use, and also you might want to use creative methods. The University of Leeds are actually doing some online jigsaws where researchers use images from their research, scientific images, for people to do jigsaws and actually think about their research. And then patient involvement, which is what we're here to talk about today. And patient involvement is about members of the public actively shaping and developing research alongside you. It's when research is carried out with and by members of the public and not about and for them. So what can public partners help you with? They can help you with thinking about the recruitment to your study. They can help you think about ethical considerations. We've had fascinating discussions with orthopaedic surgeons about the ethical implications of consenting people who've recently experienced trauma, for instance. And members of the public are really well placed to give you advice about that. They can help you think about the research question: what's most important to people living with this condition and what will make the biggest difference? They can help you with participant retention. And we often find that studies that have had patient involvement in the design in the early stages are the studies that really retain their participants, because they've listened to what is a realistic ask of the participants within that study. And what will people sign up for and what won't they, and what would be too much of a burden on people. And they can think about the accessibility of your protocol for members of the public. And you can involve patients who have the condition that you're researching, but also you can involve members of the public who just have an interest in research. You can involve carers and family members who will understand that some of the lived experience of that condition. And key to patient involvement that we often get asked is there isn't a need for ethical approval to conduct patient involvement activities. It's actively encouraged that you're talking to patients as early as possible about your research. So why do we do patient involvement, and what are the principles that underpin the public partnerships that we have? So firstly, and essentially, we value lived experience. The people who live with a condition live that condition 24 hours a day. They understand what that experience is and understand what would improve their experience of that condition and can bring a different viewpoint to the table. It challenges the traditional balance of power. So traditionally, a doctor would understand a condition from their medical and scientific experience and would tell a patient what was best to do. And actually, patient involvement is about being person-centred and saying, actually, people have a right and an entitlement to plan for their own health outcomes and to be involved in how we design research that meets their outcomes as an individual. And it looks at what's important to people with a condition. So in terms of from a health perspective, medical people can understand what is important for people. They can help with what's health and safety elements. They can help with what's the right tablet for something, but what they can't tell you is what creates happiness for a person, what creates satisfaction of life for people living with a condition. And that's what our public contributors can help you think about. And by combining the two, the uptake of the final treatment is much more likely to be retained by the member of the public. And you'll often hear the word co-production, which is really the approach we would like to take to public involvement at Leeds Biomedical Research Centre. It's an approach in which research practitioners and the public work together to share power and responsibility from the start to the end of the research project. It recognises the knowledge of both public partners and medical professionals as being of equal importance and redresses some of those power differentials. To do good co-production, there needs to be really clear roles for members of the public. You should be clear about how people are involved and provide real responsibilities so that this isn't tokenistic. This is about people having a real say and impacting on research. And to involve people effectively, the research needs to be accessible. So particularly around language, if you're involving members of the public, they have to be able to contribute effectively. And some of that is around ensuring that the language that you use is accessible to anyone. And co-production is very much a broad approach. It's very much about principles of how you do things. There is no one size fits all. It's very much about developing an approach for your research. And if you would like to do co-productive research, there's a really good document on the Involve website, which I've just linked there for you. And now we're going to hear from Professor Anne-Marie Keenan from the Biomedical Research Centre with her top tips for researchers. Sorry, she's just coming in from the video. You may need to skip this one. It might be the video isn't going to stream.
Patients in any kind of patient-facing research, because it stops researchers being distracted by things that may be to research.
Hi, Gwyn. It looks like Anne-Marie's been frozen.
Oh, sorry. She was playing for me, but not for you. I do apologise for that. We'll circulate the slides and then you can see what Anne-Marie had to say. So why is patient involvement in health research important? And this is something that Anne-Marie touches on in her presentation. And these pictures have been developed by our public partners. And so firstly, there is no research without patients. Patients are central to how we do research. It's essential that the patient voice is heard to ensure that the treatments that you develop are taken up. Patients often give you a different viewpoint, and that different viewpoint can often give you solutions to some challenges you've been circulating in your head. They'll ensure the final outcome is patient focused, and also it will help you get funding. Most funders will want to see, particularly the NIHR, want to see good patient involvement, and they want to see patient involvement resourced well. And there's also benefits to people who get involved. It can improve people's confidence. It can give them a network of people who've got a shared experience of that condition area. It can improve their knowledge. And it's important to recognise why people get involved, because that can help you keep them involved in your activities. There are loads of different activities that you can do to involve members of the public, and here are just a couple of ideas. You can set up a project advisory board for your research that can follow your research through the research cycle. You can have members on your project steering group, and we normally recommend you have 2 members in case someone can't make it, and also to give each other support. Some people have a member of the public as a supervisor to sense check with them throughout their research project and ensure they've always got that public voice as central to how they're planning and how they're delivering their research. You can have peer interviewers, so you might want to involve a member in actually doing some of your research with you and helping you out with delivering the research. Our members are often your key champions. You can involve them in disseminating the outcomes of your research and passing on that message about what you found out. You can run focus groups in the run up to your research to help you design and help your research question. And also, we're much more, obviously at the moment, we're doing a lot of online work, and you can do online discussions and surveys. Now, good patient involvement starts from the beginning. Don't worry if you've not started yet. There can always be patient involvement, but as best practice, we would always encourage that you think about how you set the research question and working with members of the public to set that question to make sure that it's a question that matters to people living with a condition. There is the James Lind Alliance, who bring together patients, carers and clinicians in what they call priority setting partnerships. And they identify some of the top unanswered questions for people living with a certain condition. They give you top 10 questions for particular areas, and that's a really good reference point for you to be thinking about your research questions, and they inform research funders as well, so it is good to look at them. You might want to set up your own group through local user groups and organisations to help inform your research priorities. You might want to involve established PPI groups and go and ask those groups what questions matter to them. And Grow MedTech recently did an unmet needs conference, which the report will be out soon, and there were some really clear areas of unmet needs that members of the public came up with. Now, next we're going to move on to the involvement standards, which were developed by Involve, who were the umbrella organisation for patient involvement. These were developed in partnership with members of the public and with PPI managers from across the country. And these are a framework for what good involvement looks like. And some key areas that you should be thinking about that are designed to encourage learning and reflection.
Sorry. back here when you didn't let me.
No. Allowed to apply for.
Can I just remind people to keep their microphones mute if you're not talking?
Thanks, Carol. Thank you. So the different involvement standards. Firstly, inclusive opportunities. It's important that the opportunities are accessible and reach groups and people according to your research needs. And we'll go on a bit to talk a bit about diversity later. Working together, it's important about develop mutually respectful and productive relationships with members of the public. Support and learning. Actually, it might be throughout your research that some of your PPI members need a bit of support or learning opportunities to help them fulfil their roles. So if they were going out to do interviews or if they're presenting, it might be you want to look at some support for that. And that's something we can help as the PPI team. Governance, so it's essential that we're involving people in research management, regulation, leadership and decision making. And at the BRC, we have members of our core group who sit on the board of directors and or executives. So we take involvement in governance structures very seriously at the BRC. Communication is so essential for good patient and public involvement. Your communication should be well timed, it should be relevant, it should be accessible. We ask that people get in touch with us at least 3 weeks before you want people involved, so that we can give people ample time to read any of the documents that they need to, and also to fit it around their lives. And impact, we do. It's really important to understand what differences patient involvement made to your project. So we do ask that you let us know how you've listened to people and what difference that's made to your research. Now, Involve, some of you may know, was the umbrella organisation for patient and public involvement and steered the national direction and approach to patient and public involvement. That has now dissolved, and we now have the Centre for Dissemination Engagement. It was launched on the 1st of April this year. As you can tell, not a great time to launch an organisation. So the communications haven't been, we've not heard much yet about this beyond what the centre will do. So most of the resources are still on the Involve website, and we will let you know when they are changed over to the Centre for Dissemination Engagement. And they bring together the responsibilities that were previously under Involve and the Dissemination Centre. And I think it's really important to think about the fact that those two things have come together, and that dissemination is going to become more and more important in terms of how we reach our public partners. And their focus will be on ensuring research is reflective of communities, relevant and ready to use. And they've got the brief to promote innovation and partnership working with citizens and dissemination of evidence. And there's a link there for you to have a look at for the centre. And we will keep our website up to date with when they have moved all the Involve resources over. And then just to summarise this section, patient involvement should be ideally throughout your research cycle. It the design, the development of the grant application. It will support your undertaking and management of research, the analysis of the data and the disseminations of the research findings. And there's a document in the references that gives you some really good ideas about how you can involve people in each of those areas. And now I'm going to pass over to my colleague Amy, who will talk to you about the role of researchers.
Okay, thank you very much, Gwyn. So to start with then, the role of researchers. So designing the patient and public involvement activities. So for example, thinking about the questions that you want answering, the forum in which that you want them answering as well. Once you're in that forum, facilitating the discussions. So making sure that questions are answered that you want answering, and sort of thinking about what prompts you're going to be giving people, and also being mindful that that isn't leading. Considering and listening to patient views and experiences. So being respectful of what people have to say, and also being careful to create an environment where people feel heard, not just listened to. And in a more practical sense, ensuring that research is relevant. So this is really at the crux of PPI, is engaging with public partners to ensure that research is relevant. Ensuring that technical and scientific excellence, and making sure the design and conduct of the research meets legal and regulatory requirements. So thinking about all those processes that you have to go through with the Health Research Authority, research ethics committees, and finally thinking about communication and feedback. So coming back to the research cycle that Gwyn just mentioned, making sure that people are engaged throughout the research cycle, and particularly after you've carried out a PPI activity before you apply for funding. Even if you've not got that funding, it's really important to let people know that you haven't got that funding, and that, you know, if you are thinking about applying for it again, continuing to work with those people, they'll be much more willing to participate if you keep them updated about what's happening and just being really transparent about that. So next we'll look at the role of PPI members. So first and foremost, PPI members are there to give you insight into living with their condition. We often refer to them as experts by experience, and I think they really are when it comes to PPI, because they've got that experience of the lived condition that you don't have. Pardon me one moment. Gwyn, can you move the slide across? My memory won't stretch further than the first point. Thank you. Okay. Thank you. So they're there to represent the patient, public and carer voice. I'm going to emphasise the carer voice there because it's not just the patient who experiences the condition. It'll also be family members and those that care for them, and their insight's really important as well. And that's sort of in the emotional sense that comes with supporting somebody, seeing that life change for somebody around them, but also in that practical sense of thinking about taking them to hospital appointments as well, and how they manage that condition. To work with the code of conduct that you set. So just like you have to as a researcher, they have to as well. And listening to others' experiences comes with that as well. So it might not match their experience, but it's really important for PPI members to be mindful that other experiences differ and that they are valid. Making sure that the feedback that they provide is relevant, and this can be really tricky. It is hard to keep people on track, so that's why it's useful to have your code of conduct defined at the beginning of the session, or your ground rules, and also from that session and how you might go around and do that. We do ask that PPI members do pre-reading, and for us that's about role description. So ahead of a PPI activity taking place, we'll work with you to develop a role description so people can make an informed decision about whether they want to participate in that activity, and make sure that the expectations are clear. And that also covers some information about the research, and we do expect people to read that ahead of sessions, so they have awareness of what's going on and what things they're likely to be discussing. And finally, communication, and that's just very straightforward in the sense of if you can't attend a session, letting us know that you can't attend. And sometimes our sessions do get fully booked and we do have a waiting list, so it's really important for us to be able to sort of go to the people on that waiting list to make sure everybody can participate. So moving on, things to consider. So again, it's really important to be clear about the reason for your involvement. Why are you doing it? What do you want to know about your research perspective, from a patient perspective? Where do you need clarity? What things are you unsure about? What more do you want to know in certain areas? Building it in from the beginning, so going back to that research cycle, making sure that it's embedded at every step, and bringing people along with that journey, along with you on that journey as you're going through your research. And this does make for a much stronger investment. So thinking about good practice, so referring back to the involvement standards, is your activity genuine? Is it meaningful? Is it more than a tick box exercise? And sort of thinking about the expectations that you set for people, so being really transparent about what you can change and what you can't change. Who would you like to reach and how will you do that? Thinking about, so not just diversity full stop, but what does diversity mean to you? What does diversity mean to your research? And how will you ensure that diversity is met by creating inclusive activities? And you might have to think out of the box with that a bit in terms of how you go through the usual channels to reach patients. So you might have to think beyond your healthcare settings and other organisations that are out there in the community and in the voluntary sector. And of course, at the Biomedical Research Centre, that's something we can support you with. And the method of involvement. So how are you going to go about it? Are you going to do a focus group? Will you ask for email feedback, a survey? There's different methods for involvement that suit different feedback mechanisms. So it's important to sort of make sure that they're well aligned. Thinking about resources. So for example, if you are going to do an online focus group, have you got a Zoom license, so you're not going to get kicked out after 40 minutes. If you're going to use something that's a slightly more tricky platform, have you got adequate information that you can share with people ahead of the session? You know, do you offer them a run-through session where they can try it out? And another resource in terms of staffing support. So is there someone from your team who can take notes? And sort of thinking about the communication. So how are you going to communicate with members? How are you going to meet their access needs when it comes to communication? And also thinking back about those open questions that you have. So having an idea of what you want to know, but being really careful not to lead people too much with the questions that you're asking. So for example, you can do that by saying, you know, is such and such a barrier for you, or what barriers do you? But also on the flip side, you perceive, and sometimes you can really just get an idea of what prompts to go with just from the discussion that you're having with people. So how can we value involvement? So again, it comes back to being really clear and transparent about your reason for involvement and managing the expectations that come along with that. So being really transparent and clear about what can be changed and what can't be changed. So making sure that people have got the appropriate information that they need ahead of meetings. So we like to give people at least a 2-week lead-in time until the session that they're participating in runs. And that's just to make sure that they can get their head around the opportunity, they can ask any questions, they can think about what they want to ask in that sessions and what they want to discuss. But also thinking about meeting their access needs when it comes to that information. So, you know, is somebody really keen to participate, but they don't feel comfortable in a focus group session? Can you get their information in a different way? If you are asking for feedback on an English, plain English summary, and somebody might rather have a phone call with you to go through that information, you know, can you arrange that for them? Thinking about refreshments. So probably not so relevant right now, but making sure that when we do go back to face-to-face involvement, that you've got refreshments available to people. You know where people can get a hot drink, you know where they can get some biscuits, and also do they have any dietary requirements that you think about? The worst thing is somebody turning up saying, oh, they're lactose intolerant, and then you need to hunt for some milk that they can use. Expenses. So in involvement, we are really, really clear about making sure that people aren't out of pocket for participating in involvement activities. So are they costed in? Is there support through the university or the Biomedical Research Centre where you can make sure that those expenses are covered for people? And by expenses, we mean the cost to travel to an activity. We mean any care replacement costs if they've got to find alternative carer. We mean parking, and those things that, again, that it just costs for them to come and participate. Tied into that is recognising contribution. So thinking about recognition payments for people. So when it comes to costing in your involvement for your grant application, making sure that recognition payments are costed in within that, and that they do go along with that involved guidance where possible. I will say, though, it's okay if the cost doesn't quite match that involved guidance, as long as you can sort of think it through and it's not at the detriment of the involvement activity, so you're not under costing it, so you can put more money elsewhere. And also being really clear about the wraparound information about gathering recognition payments, so that there is that thing where they do need to be declared, and making sure that people who participate in your activities do know that they do need to declare the recognition payment that they might receive. So communication after involvement, so coming back to that research cycle. So it's fine not to be in contact with somebody for 3 months if you are waiting for a board to meet to discuss your funding proposal, but let people know that that's 3 months, and also what you're going to do once you have got that news as well, and that you will be in touch with them. And that's the same for when your research is up and running. There'll probably be a period where you're just recruiting, and you know, it might be quiet in terms of involvement for Ben, so just being really transparent that you will be quiet for a while, and making sure that you cultivate a space which is inclusive and every person around that table or involved in that activity is an equal partner. So how do you do that? So thinking about creating a positive environment. So confidentiality, this goes beyond the research that you're doing. It also reaches into the people who are participating in the activity. So their lived experiences that they share, they need to be treated with confidence as well. And that's really important to mention when you're sort of doing your code of conduct or ground rules. Sensitivity, so thinking about making sure that people, if they don't want to share something but it's relevant, that there's a forum in which they can share it with you afterwards as well, but also being mindful that people are sharing their lived experiences, and there's an element of vulnerability with that, and how you treat that with kindness and caution. Ground rules, so again, said it many times already, but it's really important to set those at the beginning of sessions, or the code of conduct, and sort of really outline what that is for the activity. And if you have an advisory group who's going to be working with you throughout the research cycle, it's a really good idea to work with them to develop those ground rules and actually have that as a co-produced, almost bit of icebreaker activity about what you expect from each other. So thinking about the methodology, so this covers the structure of the activity. So in a practical sense, how are you going to set out the room, having a table where everybody can sit just around, and you don't have one person at the front as a speaker, that it just creates a space that's open and everybody's equal within it. But also thinking about accessibility for people as well. So again, coming back to the example of somebody who might want to give email or phone feedback, or they much rather might prefer to meet you in person. So making sure that their needs are met. And active listening. So again, this comes back to making sure that people are heard, not just listened to. And a good way of doing this is having somebody from your team who can note take, which means that you can properly focus on what people are saying, and you can pick up those areas which you want to discuss in more detail. And barriers for people. So much like the slide that Gwyn went through, that was similar to this as well. We did work with public partners to find out what they felt their barriers were. And ultimately, getting over these barriers comes down to asking people and understanding their preferences, and where possible meeting their preferences. So communications, what works best for people? Do people prefer to be contacted by email? Do they prefer to be contacted by phone? Would they prefer a face-to-face meeting? Obviously the latter isn't feasible right now, but how can you work with them around it? So is a Zoom call okay for them? Thinking about the location of where your activity is going to take place. So one thing for sure we know about Chapel Allerton Hospital, it's hard to get parked, and you will have members who are arriving by car. So giving them enough, letting them know that parking is a challenge, that they might need to arrive early. Is there anyone that can drop them off? You know, that payment will be covered as well for somebody dropping them off. But also that it's a pay and display car park. That's come up a couple of times actually, making sure that people know that they need to bring cash with them in order to pay at the car park as well. So thinking about health, so you are engaging with people with long-term health conditions. So what are their health needs in terms of their participation in the activity? So often we don't do any sort of activity before 10:30 in the morning. It's find any time earlier than that can be too early for people. And also thinking about what time that activity comes to an end, so not to clash with school runs that some people might have to do. Thinking about the accessibility of your venue and knowing where, I suppose, the points are in the venue that aren't too accessible and how you can overcome those. So, for example, if you've got the main entrance to your building isn't level access, so where's the lift? And making sure that people know where that lift is. Do you need to meet them at the car and take them around? Can a member of your team support that? So the time of day, thinking about fitting it around people's lives. So again, we sort of touched on early in the morning, but also thinking about the working age population. If you're engaging with the working age population, chances are that they're not going to be able to work during the day. So it might be better to do an activity with them in the evening. And as we're now doing activities online a lot more, there's a good chance that you'll be able to use online facilities to do that, which people are a lot more used to doing now. So again, making sure that people aren't out of pocket for their participation. And with the systems that we use, it's not possible for us at the Biomedical Research Centre, for example, to have petty cash. So we can't reimburse people as soon as they participate in the activity, but it's our responsibility to make sure that we get that through our finance team as quick as possible, so they're not left without that money for as long as possible. And sort of knowledge and age, I'll wrap those together because I'm becoming conscious of time, but a lot of these things can be overcome with sort of like reassurance that people do have knowledge, and they might not have a load of knowledge around research, but they have loads of knowledge when it comes to living with that condition, and that's really important. And I think with age as well, a lot of people can be not so confident in the knowledge that they have, and it's about building people up as well and just making sure that they feel really valued in that activity. And also there's training available, so Gwyn and I run PPI training for members, so that can be a really good way of just sort of introducing people to the system and getting to know other people who they might be working with. And finally on that slide then, sort of thinking about, so do people need a taxi because of their access requirements? Are they okay to come in by bus? Is that, you know, is that feasible for them if somebody's dropping them off? Are they driving and parking? So it's just about, well, finding out what makes people feel comfortable when it comes to their transport and sort of meeting that need. So next I will hand over to Gill, who is one of our public partners, and she's going to speak about her experiences. Thank you, Gill.
Oops.
Hi everybody, can you hear me?
Yes, we can, Gill.
Oh, great. Hi everybody. I'll go through in my section about involvement, my experience of involvement in research, participation in research, and my reflection. So involvement. As a patient, if you're involved in research, you usually feel quite strong. You're experts in your own field of experience, like Gwyn and Amy have mentioned about. So in that case, we haven't got our patient hat on. I just come to research as Gill, as a person. So we're an equal part of the research team. Funders can often refuse funding for a project if there isn't strong evidence of a PPI inclusion. I mean, yes, we can look at forms, we can comment on the language, the font, form a glossary of terms, but unless we're equal partners in it or co-produce it, that's not good involvement. And bearing in mind that we've often got our networks, so that helps you on the dissemination. I thought I'd tell you a good and a bad experience that I've had about involvement that might explain it a bit better. I did a research project about older people and MSK. The lady I worked with was a senior lecturer at Leeds University. She was a nurse and she dealt with international students. And mine was, as a patient, obviously PPI, but also I worked for an organisation that helped people. And we looked, first of all, we had lots of meetings, face-to-face meetings. We looked at the project. We looked at what we wanted to get out of it, what our outcomes were. And So then we worked together to co-design the forms and what we wanted from it. We decided that we wanted focus groups. So when we got through my networks, we got a group of people that we wanted to talk to, older people with MSK problems. And at the focus group, it was me that led the group. I asked the questions, and that we felt that way that the participants were more comfortable. They weren't talking with somebody they considered, a white coat on, shall I say, but they felt comfortable because I had obviously similar conditions to them. Helen took all the notes, and then we joined together afterwards and formulated our report. At the end of it, we produced the slides for a presentation, and then we went down to London together to produce our findings. So all along, we really did co-produce that piece of research. When I was thinking of a bad example to show you, I was invited on as a PPI member. I was just asked to look at some papers, you know, the usual things that you send out to patients, about a little bit about what your research is and that sort of thing. And I said, oh, when's the meeting then? When do I meet the team? Oh, you don't need to do that. You don't need to meet us. I don't even think that my name was added to the bid, and I was never told if they got funding or not. I presume they didn't. So, but mostly I've had good experiences of working and being involved with researchers. Now, if I put my other hat on as a patient in participation, my experience of this is usually you attend clinic, you're often in a flare so that you're most vulnerable, and then suddenly the clinicians think, oh, this is an ideal patient for our research. And as you're feeling a bit vulnerable at the time and you want some help, you often agree to sign all these forms and questionnaires and have extra blood tests taken, bearing in mind that often with people with MSK problems, we've got dodgy veins, so that isn't always easy to consent to. And when in this last one that I was invited to take care involved with, I was sent for scans so they could monitor my progress through the drugs. And then I realised that I hadn't been given any treatment for my flare-up. I didn't know anything about new medication, and it was way over a month since I'd been to the clinic. And so I'd gotten the research side of it before I got the medication. I did mention it to the lady that was doing the scanning, and she must have told the consultant, and he rang me up and apologised. He said he didn't realise that I felt as if I was bullied. So I think that is a case of when you want participants, make sure that your language, that they don't feel as if they're being bullied into doing research because we desperately want the treatment. It is always difficult to keep your numbers up, but I think that the way you handle patients in their participation would help to keep your numbers up in your research for that trial or drug, but whatever you're doing. People have asked me why I do it, because often, especially like, I'll tell you in a good one for that, for participation. I was invited to be on a trial drug, and I was really felt as if I was well cared for. I was often given notes of the findings as they were going along. Anything that was a little bit wrong, like my injection sites and things like that, they were straight on it. So I didn't feel vulnerable. But other patients and relatives did say to me, oh, you're a guinea pig. So that can put patients off continuing to work with researchers. So why do I do it? Well, I've had rheumatoid arthritis for over 36 years. I've gone through no end of medications with their side effects. In fact, in the last 2 years, I'm now on my 3rd biologic because the others just didn't help me. So I feel that if I'm helping in studies and research, I'm giving something back to the NIHR. Also, I'm helping other patients. To a purpose, you think, well, I've got this rotten thing wrong with me. Let's turn it on its head and make it a bit more positive than you're actually feeling with the pain and discomfort. I hope that's helped you a little bit about my idea.
Thank you, Jill. It's really good to hear about your motivations for getting involved. I'm now going to pass you back to Amy, who will tell you a bit more about patient involvement at Leeds Biomedical Research Centre.
Okay, thank you very much, Jill. So thinking about engagement then. Biomedical Research Centre. So we've got an event programme called Ask for Researcher, which some of you may well have heard of. These are usually bi-monthly events where we invite researchers to give feedback about their research, and we've actually been able to move these online as well, and we've been holding usually about one a month or so. And our numbers aren't too dissimilar. So in the face-to-face version, we would attract maybe about 40 members during the day and a smaller number in the evening. And I'd say usually we're getting about 30 members on the online activities that we're doing. So that's been really positive during this time. We send out a quarterly newsletter, which just gives everybody on our PPI network an update about what we're doing at the Biomedical Research Centre, what's happening with our research, what involvement and engagement activities are coming up or have taken place. And we usually have a spotlight on one of our PPI members to sort of speak about that as well, and sort of like their experiences and what they've been getting involved in. We have outreach events, so that might be an activity where we go out into the community and we talk about patient and public involvement and engagement or research across the NIHR at Leeds Partnership. In terms of involvement, most frequently we do focus groups, so that will be a session with a researcher and a number of PPI members to give feedback usually on the following areas: so research design, recruitment, methods, ethics, relevance of research, and we've been holding those online as well using Zoom, and that does seem to be going quite well during this time as well. So we have a membership on our board. So from our core group, we have 2 members who sit on our executive board for the Biomedical Research Centre, ensuring that we've got that two-way flow of information between both the core group and the board. We also have members who sit on research panels and advisory groups. So I noticed a question that popped up, and the links are there for the involved website about their definitions, but an advisory group is usually a group of patients or PPI members who will work with you throughout the research cycle, giving you guidance and advice on the research that you're doing, and based upon their lived experience and the likelihood of them participating. And you've got your research panels as well, where I think Gwyn's already mentioned that you'd usually have 2 PPI members who sit on your research panel or your steering committee, who are part of that team that has oversight of the research. We have a core group made up of 10 members who, some of them have been with us since the very beginning of the Biomedical Research Centre, and they sort of give us that guidance in terms of the strategic direction of our PPI and make sure that it aligns with the strategic direction of the Biomedical Research Centre. And we also gather feedback through surveys or just other online methods, usually around patient information sheets and plain English summaries. So how can we support you? So we can give you guidance on your application and how to build in PPI throughout, particularly applications. Links to networks of other public partners that we know within the voluntary sector or the community sector, if you're interested in reaching certain groups or you want a bit of a wider remit in terms of your reach. We can organise events for you, so we can have you and ask for researcher, focus groups, and just facilitate any other involvement activities that you might like to do. We can help you with costing out your PPI activities, so making sure that you've got those recognition payments in, you're sort of planning for how many sessions you might have, and also thinking about staff resourcing for PPI activities as well. And we can provide you training for PPI members, so thinking about if you've got an advisory group, but we can also provide researcher training as well, like this as well, and we can make it more bespoke. But I think in conclusion to this and how we can support you, just come and speak to us. You've got our email address there. It's very much an open door. We'd love for you to get in contact with us and just talk through any ideas that you've got, no matter what stage you are at as well. Like, we can always work with you wherever you're up to with it, and we're just really happy to help with you with your research in that sense. Okay. And I'll pass back to Gwyn now.
Thank you, Amy, and thank you, Gill, as well. So we're just finishing off now. So just to conclude our presentation, I think a lot of people can be a bit scared of PPI, and it can feel like a bit of a demolition of what you've done and your ideas. But involve the right people at the beginning of your research, and they'll bring the building blocks for a grand design. Remember that once you finish this, people living with the conditions will be the one who your treatment will be used by. And if your house doesn't meet their needs, then they'll be straight on to Rightmove to look for another one. So make sure you involve people early so that you're not having to demolish what you've created in the end. You on a quote from Professor Dame Sally Davis, the Chief Medical Officer. Previous Chief Medical Officer, I believe. No matter how complicated the research or how brilliant the researcher, patients and the publics always offer unique, invaluable insights. Their advice when designing, implementing and evaluating research invariably makes studies more effective, more credible, and often more cost effective as well. Thank you. Thanks, Carol. That's the end of our presentation. There are some resources in the presentation for when it gets circulated.
Thank you so much to Gill and to Gwyn and to Amy. That was an amazing presentation, and I learnt a lot as well. Gill, I don't know if you can see the chat coming through, but there's a lot of love for Gill and a lot of thanks for actually sharing your comments about being both a patient involved with research and actually being on a PPI board as well. And I think everybody found that very, very fruitful. I've got a question to start off. If that's okay with everybody, and please answer whoever thinks it's appropriate. We've moved to this new normal now. We've moved to this virtual online, and we're not having face-to-face meetings. And I'm quite mindful that some people don't have access to the internet, don't have access to devices that allows them to be involved with this new, virtual PPI scenario. How do we ensure that we're actually not being exclusive and we're actually including the people that need to be involved with our research and be involved with us developing our research questions?
Thank you, Carol. That's a really interesting question. Do you mind if I start and then I'll pass you over? So we've done really well engaging people with our research. So I think firstly it's worth noting that a lot of people who probably previously wouldn't have engaged online are doing now, because a lot of people have had to adapt in other ways. So a lot of the members that we involve are older and have actually really adapted. Not everyone has managed to do that. I think it's about being really open about other options for people. Offering to call people, to put them on speakerphone in meetings, to offer technical help, because we've had people join us who actually have struggled before, and not setting up a meeting to start at 1 and getting there at 1, giving half an hour beforehand to let people in to sort of troubleshoot so people aren't panicking to get involved if they are getting involved in digital. I think it's really challenging because it is a balance between ensuring people are safe, ensuring people are included, and it is a real challenge. And Gill, you mentioned the kind of challenge around this, didn't you?
Yeah, funny enough, today I was supposed to log in at 1:45, and I've got an iPad with the Microsoft Teams on it, but I couldn't log in, so I got into a real panic thinking, oh, I'm going to miss doing this. But and also bearing in mind, especially in musculoskeletal, if you're having a bad day with your hands, pressing little buttons is not easy for patients. So if you know that they've got these sort of problems, just talking on the phone, and sometimes just talking a few times, a few phone calls, it can build up your confidence. And that's how it's happened to me, that I've had people ring me up and slowly talk me through how to put these apps on my iPad, and always offer to send them hard copies in the post. I know it's a bit tricky at this time with not being in your offices, but there are ways of printing it off and sending it to patients, because often we like something in our hands that we can write questions and make notes, so that when we do talk to you, we're not feeling as if we've been left behind right from the beginning.
Thank you, Gill.
Amy? Yeah.
No, I don't think I've got anything to add, really. I think it sort of comes back to, you know, the sort of crux of it is that slide that I covered about barriers, where it's about just asking people about their preferences and sort of understanding them and accommodating them as well. It's very similar to that in terms of how we're approaching it digitally at the moment.
There's a comment on the chat from Elizabeth, who said that she's just been accepted on the engagement excellence scheme at the university to recruit PPI engagement support champions, looking at I presume virtual PPI. So that would be really good if we can get some feedback at a later date, Liz, when you've got something to hand back to us, because I think this is the new normal, and I think, you know, we are going to have to work in this environment for some time, and, you know, what we can learn from other people, which worked, and obviously what didn't work as well, because I think, you know, reinventing the wheel as well is also quite difficult, and we're on a time. Angela's put in a question saying, have you got any advice who can't afford things like, you know, iPads, computers, Wi-Fi's to take part in such activities? Is the current advice is the current advice just to offer a telephone call, or can we actually provide the infrastructure to our PPI members? Will our grants allow us to purchase things like smartphones or iPads?
Could I come in on that, Gwen?
Yeah, of course you can, Gill.
Yeah, it's Gill. I belong to an organisation, a voluntary organisation in Bradford, and we're supporting disabled people. And through our organisation, to help people, we've been able to download some grants to actually offer iPads and phones to members of the public. So if the researchers need this, it might be worth in their communities contacting voluntary sector groups to see if they would go in partnership with them to help get this grant to help people.
There are schemes in Leeds that currently do this. 100% Digital Leeds is a fantastic scheme, and if you go on their website, you can see different locality-based schemes for people to borrow technology. However, as you can imagine, they're very overburdened at the moment, and I'm not sure how many resources are available. I think I have heard of researchers who've put into their grants to provide equipment to PPI members or to participants particularly. So I think it's a possibility. I think you will probably find that one of the biggest challenges is not always necessarily the access to the equipment. It's maybe the skills to access the equipment, and I think that's more challenging, and that's where it's good to put people in touch with 100% Digital Leeds. So if people don't have a tablet already or a laptop, quite often they might not even have the skills to access that if you gave it to them. So it'd be about having the support, and those schemes often have that support in place to help people access that.
Thank you for that. That was really, really helpful. Thank you. I'm trying to type to respond. Thanks.
No, you're welcome. Were there any other questions, Carol? I did notice in the chat actually a question that I'll answer just while we're waiting. Someone asked the difference between a project advisory group and having someone on your steering committee. So There are two different approaches. When you've got, once your research is established, you can either set up a group of, say, 6 to 8 people who will follow your research project, and you can meet separately and talk through your plans and really give you that detailed insight into the patient-public perspective. The other option is also to have representatives who actually sit on one of your research groups. So if you've got a project advisory group, for instance, actually have members sat around the table with other members of the research team. So that's not a specific PPI activity, it's actually having people on your research group as other members. Carol, are there any more questions?
Oh, it's me.
Hello.
I've done the classic talking away.
Are you on mute?
Being muted. Can I just ask you one other question? We've had this is our 3rd event that we've had, and this has been like a recurring theme that we've had through our other events, is that we have a lot of researchers that aren't actually in patient-facing activities. They're not a patient-facing profession, but they want to include patients into their research, into the building of their research question, and they just don't know how to actually meet patients. You know, we have a lot of lab-based people. How do you recommend them starting that conversation and trying to get hold of some patients to help them build their research question?
I think I'd recommend they approach a group that's already in existence. And have a discussion with them about how they can involve patients. Our public partners will often have lots of experience of those kind of projects, so we'll be able to advise about which areas people can get involved in, and can probably help plan those patient involvement activities. So we had a very similar patient focus group last week around ankle replacements and ankle replacement technology, and the researcher who led that found it really useful, and the members basically shaped how she would do her involvement activities. Gill, have you got any thoughts on that?
Yes, I mean, they could come to you and Gwen, send the details, and then as the core group, you know, we could read it and see if through our networks we could help them, because as patients, we don't always interested in drugs and everything, but how to improve our quality of life. And often these lab technicians, they're working on that, aren't they? So I think just ask the question. When I was working for an organisation, I had a student from Leeds, and he wanted to design a piece of equipment to help people with arthritis. And so he approached me, and I worked through it with him. We designed the questionnaire, the survey. I introduced him to a group of older people, and they helped him. They tested the piece of equipment, and in the end, he produced it and got it patented. So it's quite powerful when you ask members of the PPI group who they know and how much help they'll give.
Yeah, thank you, Gill. Thank you.
Sorry, I've just done it again. So I don't think I see any other questions in the chat. So I'm aware that, you know, it's just gone 2 o'clock. So can I just take this opportunity to really thank Gill for giving up her time to talk today on our research seminar series. I think the comments that we've had back, that's giving us some valuable insight into the patient's perspective, and maybe this is something we need to pursue a little bit further down the line, so that we understand what patients feel about being involved with the PPI. Can I also thank Gwyn and Amy for helping us out today and giving up their time and helping us with our research seminar series.